there's a lot that needs to be done in different parts of the response to HIV, and this can't just be done in one area. And so those areas are planning, financing, health systems, the enabling environment, civil society, and efficiency. I'm not going to go talk through the definition of each one. You'll have the slides, but I'm going to go through some examples from each area. So, early planning has been one of the key points that we've been working on. In Latin America and the Caribbean, we've conducted transition readiness assessments or some sort of equivalent in 16 of 19 countries we finance in the region. So we've really, I think the main ones that are missing are Nicaragua, which unfortunately due to the political challenges there, it hasn't been possible to conduct this work there. El Salvador has had some support, but not a direct transition readiness assessment. And then Haiti, because they're in a different part of the development spectrum, and they're doing some sustainability-focused work on the response, but not necessarily discussing transition because it's still quite far away for them. And so examples of this are the transition readiness assessments, development of sustainability and/or transition work plans, which almost every country in the region has now or are being finalized. Updating of national strategies and documents, alignment of systems, creating working groups on sustainability and transition. And then there's a few examples. Perdón, era la próxima lámina. Disculpe, sorry. And here's some examples, not just from Latin America and the Caribbean that you can see, but also from especially the Ica region and a bit from Asia as well. Perdón. I'm working on two computers. Okay. Another area, of course, that's critical is working on financing. We have to, it's not only about increasing financing, but also improving the way that financing is executed and making sure that the resources for the response are being used in the best possible way. This has included a big focus on co-financing. I hope that you've seen in many of your countries a difference in the type of more specific co-financing commitments that are being made to really emphasize the work on key populations that needs to be, where investment needs to be made. And we've seen some really promising advancements in that area. Also work on supporting health financing strategies at the country level has taken place in some countries. And there's also a big emphasis on trying to push countries to complete their national health accounts. This is something that is really, will become a more and more important part in being able to monitor the response. And I think it's really important for civil society to get more and more engaged in those processes because it allows you to just see, first push for them to be done, to know that health spending is happening, but also to use them as an advocacy tool to say spending is increasing or decreasing, the budget commitments that have been made are being realized. Things like this that are really important to follow up on making sure that any commitments that the government makes to the response are actually being implemented. And then we have investments in health systems. This is something that I think has, especially over the past 3 years, has adjusted a bit in the Latin America Caribbean region. Because many of our grants are focused on key populations, there wasn't as much investment in health systems traditionally compared to other regions. For example, on the health information systems, sometimes in commodity and procurement systems as well. And so a lot of the work has gone into helping define and cost HIV and TB service packages. There's health reforms going on in many countries in the region. Thinking of my colleagues in Honduras, we have gone through some very big challenges with the attempts at health reform there, but also just seeing if changes are in the system, how can we help influence those changes, whether they're advancing slowly or quickly, to make sure that we take advantage of the opportunities that those types of reforms bring up. I'm strengthening national capacities for procurement, and again on health information systems as well. Another area that I think civil society has been extremely engaged on is working on improving the enabling environment. We know that we're facing a very challenging time, especially in our region, where spaces for key populations and communities are shrinking, especially with the ever-evolving political context. And even when we think that there are possibly allies coming into political office, sometimes there are setbacks when there are changes in administrations. And I think colleagues in Mexico can speak to that, and will speak to that this week. And I think it will kind of be a bit of a shadow over the conference this week, and I hope that you all support them as allies in civil society in trying to push for things to be resolved. But these include assessments of legal and regulatory barriers for access to services. This is kind of also the area where the Global Fund has been financing more and more and focused on human rights in our grants. And the Global Fund is aligned with UNAIDS on the programs, the 7 programs to reduce barriers to access, to help promote human rights. And so this is an area we have in Honduras and Jamaica. There has been a specific part of their allocation of their new grants to help implement these programs. And then there's also been additional investments in this area throughout various country grants in the region. Supporting CSOs for advocacy towards improved access and service quality monitoring. Also supporting CSOs' inclusion in decision making. And I think especially as the influence of the Global Fund financially gets reduced in several of the countries we're working on, we are also trying to think in several countries of how we institutionalize the continued engagement of civil society. For example, in Colombia, which we'll get to that example in a bit as well, they're working on how to integrate into the CCN, into the National AIDS Coordinating, the National AIDS Program, so that there's ongoing national involvement through that's institutionalized of civil society and decision making for the HIV response. And then, of course, community system strengthening, which especially in our region is critical to continue the work that has been happening. There's been capacity building for CSOs to access public funding, especially in the area of social contracting, which we'll talk a little bit about later, and also where there'll be a very, very interesting session tomorrow, I believe, on this. And where many countries, where it wasn't really imagined that it would be possible to have these discussions, the discussions have actually started, and we're very happy to see progress on that. Support to the Ministries of Health and CCN for the best arrangements for procuring health products. There's been more and more countries that are using the PAHO Strategic Fund, for example, and engaging in trying to push for making sure that countries are optimizing their resources and getting drugs at the best prices possible to make space in their responses so that they can finance the prevention activities that have not been financed by the government previously. Budget advocacy, and also the support for actual implementation of social contracting. So it's great if you have a system for contracting CSOs, but you need to make sure that CSOs are actually accessing the funding that's available. And then there's the last area, I believe, is efficiency, where this is really about, in many countries, there's huge levels of spending. In Peru, you look at the spending on tuberculosis, and the problem should be solved, but it's not. And it's about where the resources are going, what they're saying, money, what investments that are being linked to the response are actually going to the response and not just covering some general human resources needs. Different areas like this, and so that's where there's, for example, in Haiti, there's been a lot of work on where to allocate resources on malaria, and we're looking more and more in Suriname. An investment case has been developed in support of UNAIDS, looking at if action isn't taken, showing that these are the areas where the government should invest. If it doesn't invest in these key populations, it loses efficiency in its response, and infections are going to increase, and the response is going to get more expensive. And this is work that we've done in several countries with partners, and that we'll continue doing because it's really part of this helping make the case to the government that even if you don't want to care about these populations, if you don't do something, you are going to pay a lot more later. And it's going to most likely also then begin to affect more and more your general population. All right. So those are the 6 areas, and I think I'm running out of time. And so there's been important investments also in the region and support outside of the country grants and what we're doing. One of that is through the Sustainability Transition and Efficiency Strategic Initiative. A lot of countries, almost all the countries in this region have received some sort of support through this. Very often it's financed the transition readiness assessments and allocative efficiency studies, sometimes work on social contracting in countries and helping develop those systems. And we continue to receive an important level of investment from this initiative in the region. There's also the CRG Strategic Initiative, which Gemma will be speaking more about. And then, of course, what's kept many of you busy over the past 6 to 12 months, which has been the multi-country funding for key populations on HIV and also tuberculosis. You're going to hear about these grants later, it's just in here, but it is $21.5 million. Most of those grants are beginning either in July or in the middle or later this year, and they'll be ongoing for 3 years. As I mentioned before, a lot of work has been done in the region to work on social contracting, which in more formal terms, we're calling the public financing of civil society for service provision. I'm not going to go through this slide. I think it's a really useful one for you to have, but it's really just that this isn't just make money available and things will happen, because we're seeing, I think our colleagues in Costa Rica especially can explain, despite all the support you may have, there are hurdles that come, and there's an important need to help continue to strengthen the capacity, both on the civil society side and the government side, to help make this work happen. It's a strategy that isn't a standalone strategy. It needs to be supported by various other components, but it's where we're seeing in more and more countries, it's the most likely response to help fill the gap of global reduction in global fund financing, because it's unlikely that there will be huge private sector investments in these areas. Resource mobilization is very challenging, especially in some of our countries where we don't necessarily have a long history of charitable giving, for example. And so how do we make sure that we institutionalize the responses more and more? And social contracting is an area that we've seen as a successful strategy to do that. But we'll have, again, a very excellent panel tomorrow on this discussion. Several of you were at a meeting here in Mexico City last June that was hosted by MEXIP and the Ministry of Health here, or Secretaría de Salud, and the Ministry of Foreign Affairs. And our colleagues in Mexico have a lot to share with us and great lessons learned, including many of the challenges they've been going through since early this year. Sorry, and just to show you that social contracting isn't something that we're just doing in Latin America. I love this slide because it really shows that there's a huge diversity of activity going on social contracting, from Latin America to Southern Africa to North Africa, Eastern Europe, Central Asia. So, and this doesn't capture everything that's happening. So we've really seen a lot of momentum on that, and that wouldn't have happened without all of your engagement on this. And we know it's tough, it's not an easy road, but we are making progress in this area. And I think lastly, there's also work in relation to the CCMs and how they engage in sustainability and transition. I think every country has had a different way the CCM engages in it a bit, and I think especially when it comes to oversight, it's been quite a mixed bag. And I think that's one of the objectives of the meeting this week, is to discuss this, and we have another panel discussion on that tomorrow. But how do we make sure that CCMs are fit for purpose to help respond to the challenges of sustainability and transition? And so in our region, there's the CCM evolution process going on. Haiti and Colombia have been a part of it. And again, on Colombia, it would be great to also hear, I suggest you discuss with them informally. They're starting to look at this process of how to integrate the CCM into the NAC. This is something that's already been done in Belize. Our colleagues in Belize can also tell you the pluses and minuses of that. But it's just kind of how, looking forward, do we make sure that there's less and less duplication and parallel efforts for coordination, and really trying to focus the resources of the response to HIV, TB, malaria in the region, and institutionalize them while we have that influence in the region. So So that's it for me. Thank you very much. I hope it's useful. We'll share the slides because there's lots of examples on there, both in English and Spanish. I'll be here over the next 3 days with you all, and thank you again for joining us.
Thank you very much, all, and thank you very much for keeping your presentation in time. And as you see in the agenda, we will cover many of the issues that Paul mentioned in specific sessions. And the next session, we will be very, very focused on the CRG strategic initiative. So, Gemma, welcome. Gemma is our guide in the process of the development of the platforms. She is the global coordinator of the platforms, and she's going to make a presentation about the overall CRG or Community Gender and Rights Strategic Initiative. So welcome, Gemma.
Okay, thanks everyone. I'm going to try to go through these slides quickly to keep us awake. I've already had a venti coffee, but I need another one. The slides are for your reference, so I will not read everything, but it's there for you, for your information. So I'm going to give an update on the Community Rights and Gender Strategic Initiative. Put up your hand if you've heard of this before. Remember what I said about new knowledge. So, okay, most of us do know. You have a green one, Alfredo, yes. So most of us do know about the CRG SI. This is a catalytic investment that the Global Fund makes to ensure communities can effectively and meaningfully engage in Global Fund and related processes. So I'm going to go through the 3 components. After a background, I will go through the first component, which is a short-term technical assistance program. The second component is long-term capacity development of key and vulnerable populations. And the third component is the regional communication and coordination platform, which is this, right? So we all know about the platform at least. Okay, so some quick background. Going to go through very quickly. Next, please. So the CRG SI is a $15 million investment over 3 years. And you can see this pie on the right is how it's split up among those 3 components. $6 million for the technical assistance, $5 million for capacity strengthening of key populations, and $4 million for the regional platforms, of which there are 6. Next, please. We do this work through a lot of partners. So it is not the Global Fund doing this directly. We are working through all these different partners all across the world. So that's how I wanted to present this. It's not a Global Fund initiative, but a big community of civil society organizations. This is our theory of change. Those of you who were at the meeting last year in Peru will recognize the bicycle, so I won't go through it again. But it shows that all the pieces work together, right? You cannot ride your bicycle if one wheel is missing, and you certainly cannot ride it without the person who is the communities at the center. Okay, next, yeah, it's animated, so you can enjoy that later. Keep going, keep going. Then we'll get to the update on technical assistance. Okay, component 1. Next, please. Here is an update of the technical assistance that has been provided through the CRG SI. Now, what do you notice when you look at this slide? What do you see? Lots of English African requests. What else do you notice? It's small writing. The blue is the requests we receive. The green is the ones that are approved, and the, what is that, orange is the ones completed. So you can see it's a cascade as well. Okay, but I want to give you an update because this is